Ricky Henry Live.
Ricky Henry Live. Woohoo! Shout out to Ricky Henry Live.
Ladies and gentlemen, I think we are going to start with the speech.
Okay.
As Solange gets ready to start.
Welcome back again. Good morning, everyone. Again, the National Lawrence and from the
As Heritage Teenage Mothers Foundation, we also embrace the LGBT community, and we are going to get information on how HIV/AIDS has affected the community. So I'm so grateful to everyone. Can we clap for the youth that are in this building?
Thank you so much. Our boss, Amanda, social worker, an entrepreneur. We want to thank you so much for this opportunity and always being a vision bearer, carrying out such conferences that gives out information to different people, especially the newcomers. And we don't take it for granted. Thank you so much for making your time to be here this morning. And I hope and I believe that by the end of the day, we should go home with some information, at least each of us. Thank you so much once again. Without taking so much time, I'll invite Gloria Tabor from African Partnership Against AIDS. Could you please come share with us briefly what you have on your table and what you can offer for today's class, please? Thank you so much. As she's coming, Giovanni Proceed from Community Connections. Get ready to step up. Thank you.
I'm Gloria, and our table is AFA, which stands for Africans in Partnership Against AIDS. And what we have on our table is we have condoms, because applicants, volunteers, or people that want condoms. We also have HIV/AIDS self-testing kits that you can test yourself for HIV/AIDS at home. We have flyers that tell you about the services that we have, our programs and services. We offer HIV prevention, support, community development, and volunteer and community engagement. And we also offer harm reduction. And volunteers or people that want condoms. We also have HIV/AIDS self-testing kits that you can test yourself for HIV/AIDS at home. We have flyers that tell you about the services that we have, our programs and services. We offer HIV prevention, support, community development, and volunteer and community engagement. And we also offer harm reduction. And that's what we have on our table. Thank you.
Giovanni is see here. Okay. Proceed. Good. Clap for her, guys.
Hi everyone, my name is Rosie Percy. I work with Care Community Connections in New Market, York region, and it's a pleasure and honor to be part of this great engagement. And Care Community Connections is formerly the CAT, the ex-committee of York region, and we have a range of services and programs. We have harm reduction.
That's what we have on our table. Thank you.
Giovanni, you see here. Okay. Good. Clap for her, guys.
Hey everyone, my name is Rosie Percy. I work with Care Community Connections in New Market, York region, and it's a pleasure and honor to be part of this great engagement. And Care Community Connections is formerly the CAT, the ex-committee of York region, and we have a range of services and programs. We have harm reduction program, harm reduction education. We have HIV support services, youth program, and women's program. Today we come with a number of items we are exhibiting on our table. We have HIV self-testing kits. We have information materials about our programs. We have harm reduction supplies. Please take a minute to visit our stall, and we shall provide information. For those who are coming from York region and New Market, we are found on Leslie Street, 17665, Leslie Street, Unit 12. Thank you so much.
Thank you so much. One thing I know, we're not here by mistake. We are here with a divine appointment. And I want to welcome you once again for this wonderful conference. Allow me to invite Mrs. Natasha Rollins, please. To
break the stigma, to get rid of HIV, we need to be with the communities affected. Instead of teaching, instead of wasting people's time teaching them the jargons, let's start using languages they already understand and get to the solution.
To everyone watching, here you can get free stuff, free condoms, free HIV kits. Yeah, these are kits
These are the blind spots
for testing.
That's it,
Yeah.
infections that you in or increasing. What you need
This is body moisturizer.
that is lower than they would
Okay.
have. Because we forget communities that
These are loops.
embarrass us.
Okay.
We forget communities that feel make us uncomfortable.
Mm-hmm.
And that's why we
Yeah.
have started the first
This is harm reduction. Okay.
After all,
It's ready. What's that? Thank you.
Well, I'm back again. Good morning, everyone. Again, it's Ashley Lawrence. I'm from Women's Health and Women's Health Community Health Center. As I mentioned, our table is right over there. We have our peer distributor here present to distribute HIV self-testing kits. As I mentioned before, if you're more than welcome to take the kit home and conduct the kit yourself on your own time. However, if you wanted to do the test here, then I can, and you want to have
We are over 40 years now since we first discovered HIV in 1983. I think it's 41 years now because it was February 1983. So 40 years of HIV. It's been a long journey. We've come from the bottom, gone up, gone down, gone back up. But we still discuss the same things. Sometimes I feel like a broken record. Because I've said things in Uganda, I've said things in South Africa, we've gone to Geneva, we've come to Canada, we've gone everywhere and we keep on saying the same thing. And we keep on speaking to the same people. How many people here have been to HIV conferences before? How many people can say this is their first HIV conference? Wow. Baptism of fire. Welcome to my one. You see, we keep on saying things around conferences and then we go for coffee and we come back and say things and then we go for lunch and then we affirm, and reaffirm. But what are we reaffirming? When we say we're coming here to break the silence on HIV stigma, what does that even mean? What does stigma actually mean? Every time you hear about HIV, you hear stigma. But have you ever sat down and asked yourself, what does stigma mean? The scientists will tell you what stigma means. The social scientists will tell you what stigma means. I don't consider myself to be either. I'm just a guy who studied economics and talks too much. So I'll go with the English definition. See, according to the dictionary, stigma is just a disgrace associated with a circumstance. It's not only around HIV. I'll take you to something closer to your heart. For example, if you're a parent and your daughter came and told you, I met this guy and I think I want to marry him, but he spent 15 years in jail. Your first thought is going to be like, no. That is stigma. If someone came and told you, this guy, your son came and told you, I met this guy, I'm in love, you're going to be like, yeah, I respect it, but I don't know. That is stigma. So every time you associate a negative connotation with a circumstance, that is stigma. So stigma is not just something we throw around and say, breaking HIV is stigma, breaking stigma against the LGBT community, breaking stigma against sex workers, breaking stigma against people who use drugs. But you're breaking stigma against people who use drugs. But when those people go to the washroom, you're like, that guy is a mental. So you're still stigmatizing them. We get onto the microphones and say things which you don't even believe. That is why these fights take decades. That's why these fights take forever. Because we say things, because that is what was written in the proposal. We said things because UN told us 95, 95, 95. So we all went around that. 95, 95, 95. But what does it mean? As someone attending an HIV workshop, what do you think you throw around me? So for me, in the years I've been doing this, I've got to the realization that I'm going to stop saying things because everyone is saying them. I'm going to stop saying things because they make me look smart. I'm going to stop saying things because they make me sound like an expert. I can come here, I know all the jargons, I've been saying the things for 10 years. I can come here and give you all the UN AIDS things and I sound like somebody who just landed from Geneva. But then you go home having learned nothing. Just having seen, oh, that guy really knew his HIV one. Just get away from saying things that make us look smart and make us look experts. And start saying things that actually mean something to communities. Start saying things that communities understand. Because that's what To break the stigma, to get rid of HIV, we need to give the communities affected. So instead of teaching, instead of wasting people's time teaching them the jargons, let's start using languages they already understand and get to the solution. Let's stop acting smart and start trying to find actualism. What I was doing work in Uganda, like I said, I was working with so many minorities. We realized that there was a gap. There was a time around between 1997 and 2006 where Uganda was the star around the world. Everyone was praising Museveni and how he has fought HIV and how HIV infections in Uganda have dropped at a very low level. And it was all roses. And global fund was pouring money to Uganda, and my friends were taking all the money as aiming just to their bedrooms. But while all that was happening, so many people were being left behind. We had grandmothers who were raising orphans because their children had died. Those people were being left behind. We had transgender people who could not go to hospitals because they could not answer questions about whether they are male or female. They were being left behind. We had men who have sex with men who could not go and explain how they got the infection in body. They were being left behind. But globally, and in the news, in the press, everyone was saying Uganda, 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 Uganda. These are the blind spots in HIV that keep the infections plateauing or increasing, or even if they are falling at a rate that is lower than they would have. Because we forget communities that we think embarrass us. We forget communities that we feel make us uncomfortable. And that's why in Uganda we started the first clinic for sexual minorities. I think we launched it in, I'm too old to remember some of the things. Oh, we launched it many years ago. But why we did this is we wanted to prove to the government that the groups you're calling had to reach. Because those were the words we were releasing. You know, I told them some of these HIV/AIDS jargons had to reach communities. Wanted to prove to them that these communities are not hard to reach. You're just not putting any effort. So we started a clinic for these hard-to-reach communities to tell the government, here are these communities now. We have done the job, we have reached them. Can we provide the services? And then they began meandering. And the same applies everywhere you go. Ask yourself why we need HIV-specific clinics and HIV-specific organizations in a country that everyone wants to go to, like Canada. It's because even in Canada, despite all the progress, the stigma still exists. Despite all the progress, we still hide HIV clinics in safe places. Places where people will not be embarrassed to go to. Why? When we are launching COVID clinics, when we are launching cancer clinics, we put them anywhere. We put them at gas stations, we put them at subway stations where everyone can access. But when we are launching HIV clinic, we put them where someone can see. No? Why? We are acknowledging that even in Canada, we have stigma. When someone comes out to a microphone like this and says, hi, I'm HIV positive, or hi, I'm gay, and then at the coffee break, people come and pat them on the back. You're so courageous. Thank you for your courage. Thank you for standing up. When you do that, you're acknowledging stigma. Because if I came and say, hi, I'm a superstar, I'm a rapper, I'm this, I'm that, you're going to come to me and be like, that was so brave. But when I come up and say I'm HIV positive, oh, thank you for doing this. You're acknowledging that this is a stigmatized community. You're acknowledging that coming out, as long as you know deep inside you that coming out under such a circumstance makes you brave, then that community is stigmatized. As long as you acknowledge that someone is brave just for being who they are, then you're acknowledging that this person belongs to a stigmatized community. But But let's get it from the international perspective. Let's talk about Canada because that's where we are right now. Sometimes when you do so much work away from where you live, you forget about the local situation. But I know that we might have some newcomers here, and I really don't like figures, despite the fact that I did economics in school, but it's very hard to talk about HIV without actually talking about figures. Because figures paint the real picture. They paint the face of what we're talking about. Canada is what we call a first world country, a developed country. We have about 65,000 estimated HIV infections in this country. Of those, let me look at my figures. About 89% of those are diagnosed, and 85% of the diagnosed are on treatment. And of those on treatment, 95 have a suppressed viral load. Those are good numbers. Those are very good numbers, but they are not what we agree on. They are less than what we agree on. Many years ago, we were in Geneva and we all agreed that we were going to do 95, 95, 95. And today, about only 5 countries are there. I think it's Rwanda, Tanzania. Just about 5 countries have achieved that. So even countries like Canada are struggling to achieve these numbers. And why is that? It's because we are not doing what we agreed to do. We are not using the human rights approach, the people-centered approach to do things. We are using budgets to fight HIV. And yes, we need the money. We need the money. But if we use budgets to fight HIV, you're not going to center the people. You're going to look at people as figures. That's why I don't like using figures when I'm talking about this. I use them just to paint a picture. But we have made the fight against HIV in the developed world mainly budget center. Why? Because we are the taxpayers of this country and we have a burden for the HIV support all over the world. We have to contribute to the UN, we have to contribute to UNAIDS, we have to contribute to all these HIV conferences. We are the funders of all the HIV organizations around the world. So the burden of financing the HIV fight is on the developed world. And it causes what we call funders fatigue. People are just tired. You're giving billions to HIV every year. 40 years now. 4 decades. Every decade we're giving billions of money to HIV. So everyone gets fatigued. And we begin thinking of HIV in terms of how much I would spend on HIV next year. And that's why we have a problem, because we have forgotten to center the people. We've forgotten to put people at the center of the struggle, and now we're looking at it in terms of figures. We contributed 5 billion to the HIV fight, and that is something we're going to put in our report. That's something we're going to be very proud of. That's something we should present in New York. That's something we should present in France. Canada is doing a good job because we're investing billions of money into HIV. But are you investing in the actual human resource, the people-centered resources? Because when Ukraine asks for bombs, you give them billions because you listen to them, and I would say we want long-range missiles. You listen to them and you say the long-range missiles. But when it comes to HIV, you do not listen to the people affected. You think for them. You think for them because you know your goal is not to end this. Your goal is just to tick a box. You give them the money. While on the other hand, you listen to them because your goal is to actually end that war or win that war because it's politically correct for you. So the problem here is we think of the developed world when we give away this funding, we've done our job and we don't have to come back and sit around and be people-centered. That's why HIV organizations, even in Canada, right here in Ontario, we have all of them in here. They will tell you they're struggling with budgets. Funding is shrinking because now we're competing with funding, and the political landscape is not favoring the funding for people of color and HIV. Because we have a migration issue here. It's already tested. Talking about the migration in this country is already tested. So when you're looking for funding to support these immigrants, it's already politically risky for the politicians because they already take a lot of fire on our behalf. So they don't want to invest more. They're like, you came, we gave you charity works, we gave you papers, we gave you hotel, we gave you this, now you're asking for HIV money. And if this goes into the press, then it becomes politically sensitive for them. So it's becoming a problem. The funding is shrinking, and it's shrinking very fast. It's shrinking very fast. I think the target was 40 billion. It was about 39.9 billion globally. And we were less than 20 billion. That's almost 50%. That's almost a 50% deficit. Because it's becoming politically costly to invest in communities of color and HIV. It's already politically sensitive to invest in communities of color. But now, you take it even a step further. That's what I call in Malay language double discrimination. So as people of color who are interested in fighting HIV within our communities, what is our role in this shrinking space? Apart from attending workshops and posting on social media, what is our actual role? What are we actually doing? I came here really to talk about the realities around sexual minorities. And I'll tell you what sexual minorities are doing. Because in these communities, it's double stigma. You're stigmatized as a transgender person. You're stigmatized as an intersex person. You're stigmatized as a gay person. You're stigmatized as a lesbian woman. And then, within that small community where you're stigmatized, now you have to come out as HIV positive. And you're stigmatized even in that small corner where you find yourself at. It's literally double jeopardy. That's why when people are pushed against the wall, they fight back. That's why sexual minorities are making so much noise that you never find a presentation at UNAIDS that does not include the word MSM. It has been decades of fighting to make sure that men who have sex with men are recognized as the most at-risk population. So, as people of color, how much push are we doing? Apart from self-stigmatization, I was at a conference a couple of months ago, and I posted, it was an HIV-related conference, and someone came to my comment, and this person came to commenting, I would like to see this, I would like to see this. And I was like, remember, just go to my inbox, stop embarrassing me in public, like make people think I'm sweet. But anyway, I got to his inbox and we met for coffee. And Steve told me something very touching. He told me he had met a girl and had started dating, and he felt that they were taking it to another level. But he is HIV positive. His viral load is undetectable, so he's anti, he cannot transmit it. But he wanted advice from me on how to approach telling his girlfriend that while we're together, I would like you to know that I'm actually HIV positive. And his fear was that immediately he says it's going to be the end of the relationship. These are the realities of people living with HIV today. You fall in love with someone, and the only judgment they have is like, I like everything about you, but I cannot believe someone's HIV positive. The fact that someone has to come and find a stranger on social media and tell them, how do I go about this? How do I tell my girlfriend I'm HIV positive, but she is in no danger at all? Because, we have laws against this. Even in Canada, in 2012, the Supreme Court held that someone can be liable for aggravated assault if you do not disclose. before sex, if you do not disclose. Because what is the word they use? I don't want to misquote the code because I'll be in trouble. In 2012, the Supreme Court of Canada held that a criminal law imposes a duty on a person to disclose their HIV positive status before sexual activities, if that activity poses a realistic possibility of transmission. That is very vague. What is a realistic possibility of transmission? Because scientifically, if someone is undetectable, there is no realistic possibility of transmission. If I'm going to use a condom, is that the realistic possibility of transmission? Okay, what is that? So the court leaves it out there. And then you as an HIV positive person has to take the responsibility. And I'm not saying we need the law to tell us what to do, because sometimes it's just, if you care about someone, you want to take care of them, and you want them to be able to make informed decisions. So I told this guy, no, it's not even about the law. It's not even about you fearing that you're going to lose this person, but it's about you being true to yourself. It's about being true to yourself, because you don't want to hide something as important as that, and then your partner finds out later. The risk of betrayal. But these are things that people who are not HIV positive cannot understand. These are life-changing moments that people who are not HIV positive cannot understand. And we who provide support to such communities, we don't even know how much the person just come and say we shall give you the support. But at that point, we have counseling services for that. So at Stigma, do you have counseling services for people who want to come out to their partner? Have you ever had counseling services like that? But HIV people fall in love. So who do they go to? Who do they go to get that information when they want to disclose? These are the gaps we have, these are the blind spots we have. And that's why conferences like this are important. Because these are things you need to boldly tackle and discuss. Because they're real. And even if you think they don't affect you because you're negative, even if they don't affect you because your partner is negative, you don't know what happens tomorrow. You don't know what your partner is doing at those conferences. Because you test it at the beginning of your relationship, but because you test it every year, it doesn't mean that in the middle, things won't change. One time I was presenting in the Parliament of Uganda about I'm a superstar, I'm a rapper, I'm this, I'm that. You're going to come to me and be like, that was so brave. But then I come out and start to say, oh, thank you for doing this. You acknowledge that this is the stigmatized community. You acknowledge that coming out, as long as you know deep inside you, that coming out under such a circumstance makes you brave, then that community is stigmatized. As long as you acknowledge that someone is brave just to be who they are, then you acknowledge that this person belongs to a stigmatized community. Homosexuality law. And I told this boy, see, when you look at LGBT, we look at them as them, those people. But you don't know who your wife is sleeping with. You don't know who your husband is sleeping with, and they're like, not mine. I'm like, yeah, everyone says not mine until it's yours. So right now we're doing at things as other. But trust me, we breathe the same air, and we're in this together. And let me tell you how we're in this together. When COVID came, that's when we realized that health is not a luxury for those who can afford it. And just so you know, the model we used to fight COVID is actually an HIV model. COVID stole from the HIV model because it was a health crisis and there was already a model existing. And now we have mpox. We're using the same HIV model to tackle mpox. So whatever we're saying, those HIV people, that same model which the HIV positive people designed 20 years ago is the model that was used for COVID. So we're in this together. And I would like to encourage you as a close that let's not look at ourselves as helping others by by stopping stigma. Look at it as helping yourself by stopping stigma. Because stigma does not only affect the person stigmatized, it also affects the person doing the stigmatizing. So let's not go home thinking, oh, today I did a good job, I helped HIV positive people. No. You helped yourself. You did this for yourself. You did not do this for other people. So let's stop having that. We are supporters. We are here and we are helping those who are vulnerable. So as we look to the future, let me leave you with 3 priorities. These are the same 3 priorities that have brought us this far. First, we need to continue harnessing the power of science, from basic to behavioral science and everything in between. We need to develop new and more powerful tools that work for the communities, not according to what budgets we have, but the tools that the communities are asking for. We need to continue listening and responding to voices of the affected communities and develop programs that they have asked us to. And third, we need to keep human rights at the center of everything. We need to respect the rights of women and children, adolescent girls, minorities, because if we don't put human rights at the center of our approaches, we are going to keep coming to these workshops for the next 50 years. HIV has taught us, and COVID and MPOX have reminded us that we're in this together. On my behalf, as a man who works with Rainbow Road, helping LGBT around the world move from places of discrimination to places of safety. And on behalf of the African Center for Refugees in Ontario, to which I'm the chair of the board, and on behalf of the New African Canadians, where I'm the vice president, we pledge to continue supporting the move and to continue supporting the fight against HIV. And on my own behalf, I wish you very, very fruitful deliberations today and tomorrow. And before I leave, I'm a guy who works very hard, but also like to play really hard. So if any of you here enjoys a good life, I would like to invite you to this very place tomorrow at 7 p.m. for the Drake Garden concert. Thank you so much.
Thank you so much, Mr. Dennis Wamala. Let's give a hand clap to Mr. Dennis. Quite thought-provoking. I'm sure your video has left you thinking about so many things, and very, very interesting. And personally, I'm challenged. I'm thinking. I don't want to comment right now, but wow, thank you so much. And someone who comes from Uganda, wow, thank you so much for the work that you're doing. Yeah, thank you so much. And right now, it's so good to see all of you who have just joined us, just in case you've just come in. We were expecting you, and it's so good to see you. You missed breakfast. I'm not sure it's still there. But yeah, just in case you missed it, lunch is around the corner, so don't you worry. We are going to be listening into a poem from the beautiful Solange. Yes, and Solange means her way. Make yourself comfortable, say hi to your neighbor, extend kindness, from what Mr. Wamala said. Let's be kind, be interested in what your neighbor is doing, how your neighbor is feeling. You never know what is going on in their life. You never know what they're struggling with right now. So be kind, be a good neighbor. Yes, let's welcome Solange. so all you need. Thank you so much, Solange. Let's encourage Solange by...
While we're together, I'll let you to know that I'm actually HIV positive. And his fear was that immediately he says it's going to be the end of the relationship. These are the realities of people living with HIV today. You fall in love with someone, and the only judgment they have is, like, I like everything about you, but I cannot be with someone who's HIV positive. The fact that someone has to come and find a stranger on social media and tell them, how do I go about this? How do I tell my girlfriend I'm HIV positive, but she is in no danger at all? Because, like, what is that? So the court leaves it out there. And then you as a HIV positive person have to take the responsibility. And I'm not saying we need the law to tell us what to do, because sometimes it's just, if you care about someone, you want to take care of them, and you want them to be able to make informed decisions. So I told this guy,
Thank you so much for that presentation. What a wonderful session we just had, right? You don't seem to agree. Yeah, that was really, really informative. I don't know what to use. And I don't know about you, but for most of us, personally, we have our personal stories when it comes to HIV and stigma. Some of us know of friends that won't say anything to even to, for example, their boyfriends or girlfriends, just because they are worried. And much as you might feel like you have to talk to someone, you want to facilitate it, stand in their shoes, to really, however, like they say, let's get facts, let's get the right information for us to be able to stamp out stigma. Yes, let's say the word is stamp out stigma, right? Say that after me, stamp out stigma. Yes, and we'll do that by participating in such meetings, finding out the right information, and like Mr. Amanda said, you're doing this for yourself because you don't know. It's not about them, it's not about, people who are living with HIV. It's about you yourself. You being here, you're doing this for yourself. If you are living with HIV causes, we are doing this for ourselves. But if you think you do not have HIV, you're also doing it for yourself. I'm doing it for myself, regardless of my status, because you do not know what's going to happen tomorrow. You do not know who you're going to meet. You do not know how you're going to use this information when you live this place. So it's wonderful that you are here. Once you recognize that we appreciate that you've come. We know we have different activists here, social workers, mental health workers. We have different organizations represented here. I've seen representatives from Black Coalition for AIDS Prevention, where I volunteer. They are in the building and they're doing a great job. And I know in so many organizations like Black Cap that are represented in this place. And we want to say we appreciate, we see your work and we appreciate what you're doing for the African, Caribbean, and Black communities, especially. In our next session, we are going to welcome women's health in women's health in women's hands. Yes, we have I believe Miss Irene is in the building, and so together with me, let's welcome Miss Irene from Women's Health in Women's Hands. Give us a presentation. Thank you so much. Yes, welcome. You're welcome. She's doing a great job.
to the presentation with my colleague. I will try to introduce herself now.
Hi everyone, my name is Ori Sobel. I'm a colleague at Women's Health and Women's Hands. I'm a program lead for the National HIV Prevention Strategy for African, Caribbean, and Black folks in Canada. And I'll be elaborating a little bit more on my project a little bit later.
Thank you, Ori. I have a presentation to make, and can we go to the next slide, please? Also, a social worker in Ontario, and so many folks that we work together or we've supported in the community. So, Women's Health in Women's Hands is a community health center, and I want to talk about who we are. Next. So, we are feminist, pro-choice, addresses, and bilingual health center for women, trans, and non-binary people. What does this mean? That we see all African, Caribbean, Black people, and all folks that identify as Blacks. We provide primary health care to racialized women, trans and non-binary individuals from the African, Black, Caribbean, Latin American, and South African Asian communities in Toronto and surrounding municipalities. Services provided include primary health care services, health promotion that also include the fight of stigma, and mental health services, nutritional including an emergency food bank, food care, community education, advocacy, outreach, anonymous HIV testing, and HIV care, treatment, and support. So why are we here today? We have a very big project that takes care of over 1,000 SCP women living with HIV, because it's a very big community center. But every time I do a presentation about our center, I talk about how not only individuals have been stigmatized, but even the center has faced stigma. Because women's health does not only see people living with HIV, it's a whole community center that provides a whole comprehensive health care. But when you're in the community and we are seeing that when you're going to women's health, you're HIV positive. That is stigma. Women's health is not a center that sees people only living with HIV. So sometimes it's only not individuals that are stigmatized. Even places that we go to, stigma is attached to them, that we have to stop stigma. And many folks have faced stigma from the community just because they are serving and advocating for people living with HIV. People have lost relationships because they are being questioned, why are you working with people living with HIV? And I'm grateful to be to partner with people today to fight stigma. Where are we located? Women's Hands in Women's Health is located at 2 Carlton Street, which is by Young and Carlton, and we are on the 5th floor, suite 500. Women's Health in Women's Hands is unique because we see all folks in Toronto and neighboring communities who do not have status. If you do not have status, whether you're a newcomer, whether you have lived here and you have failed to get status in Canada, you are able to access comprehensive health care at Women's Health. So that really makes us unique. So if you lose your federal interhealth program, you still access your regional medications at Women's Health. That is the message that I always pass out to people. We are unique because we see people that have precarious health insurance. Next slide, please. So, what are our planned demographics? We see immigrants, refugees, cultural and linguistic backgrounds. Our population starts from 16 years and above. Women with disabilities, LGBTQ women, non-binary and gender non-conforming individuals. Next slide, please. So our top 5 clients, ethnics are Caribbean, African, Latin American, South Asian, and others, and those are our data that we have, that we see at Women's Health. So the top issues addressed are diabetes, food insecurity, anxiety, and that's mental health and related issues, hypertension, periodic health exams, cervical cancer screening, abuse, and HIV and AIDS projects. Our top programs and services, like I already said, diabetes education. You know that most of our aging groups initially had high data in diabetes, but now we also find that even in our young populations and generations, diabetes is shooting so high. So we do a lot of diabetes education and prevention, management, individual counseling, and all group sessions. Can you go back a little bit more? We do pre and postnatal support, and I know that so many newcomers come here and they do not have health insurance, so we support a lot of people that do not have health insurance with prenatal and postnatal support. Interdisciplinary classes providing support with HIV/AIDS still, holistic approach, we do education, prevention, care and advocacy, policy and research. We do a lot of community education. We have groups going on for women living with HIV/AIDS every third Saturday of the month. And this is basically to support them to social network, support them to get employment, get to know their own communities, because they face a lot of stigma when they try to social network with people who are not of their own status, and with Canada being attached to decriminalization. But of recent, we have also separated the group according to the age. So we are having the women who are 50 plus alone meeting and social networking, and then the age of 50 and below also meeting and social networking, because they have different interests and goals. I will stop on that one because I want my colleague that's doing the prevention part of it to take over. Thank you. Do you have any questions for me for now? Thank you. I'll take over now. Okay, Natasha joins us. She'll introduce herself.
Thank you, Irene, for that presentation. For those who have joined a little bit later, I'll introduce myself again. So my name is Natasha Lawrence. My pronouns are she, her, and that. And I'm a community health worker at Women's Health and Women's Hands Community Health Center. So we're going to be talking about, or even myself, we're going to be talking about some of the prevention strategies that we have at the center. A very exciting one that we're about to embark on is the Women's Health and Women's Hands PrEP project. So, next slide. So this project aims to increase awareness, education, access, initiation, and retention of PrEP for African Caribbean and Black women by providing educational sessions on PrEP, as well as creating educational resources. We also will be implementing a PrEP clinic at the center so that we can increase access to PrEP and also to support ACP and other racialized women with different issues around PrEP, because there's a lot of barriers when it comes to PrEP access, barriers like affordability, barriers around the initiation of PrEP, also adherence, right? So when you're on PrEP, for the oral PrEP, it's really important to take those pills or the pill every day to continue to reduce the risk of HIV transfer or acquisition. So support services are really important, so we'll also be providing that within the clinic. And we'll be organizing annual forums to bring HIV service providers, ACB community members, and other racialized women at risk and community leaders to discuss strategies to increase awareness of HIV biomedical prevention strategies. And as well, too, as Dennis mentioned before, right, funding is such a huge issue. So how do we make these things sustainable? Oftentimes, because we have funding that runs out, we provide these really exciting and great prevention strategies or other ways to support the community. But then once the funding ends, what happens to all of these projects and programs, these groups, these different support services that are really there for the community? So it's really important that we start to think about how can we make these things more sustainable so that we can continue to, because another issue as well is that for African, Caribbean, and Black women, we're seeing that there's lower rates in terms of both education and awareness of PrEP, and even for those who may be eligible for PrEP, there's lower initiation of PrEP and lower retention on PrEP. So we're trying to really, connect with the community and figure out, what are some ways that we can help to support access to PrEP for our community members who may find it useful to use within their prevention strategy. Another prevention strategy that we have at the center is our anonymous point-of-care testing program. So this program helps to increase access to testing for ACB community members and women as well. We train our staff and peers to receive certification to conduct the point-of-care testing. And point-of-care testing is very similar to the self-test kit, except it is administered by a certified tester, and it also includes pre- and post-test counseling. So it's an opportunity for folks to receive some education, some resources, as well as some recommendations, just based on their own needs and their own activities. And it also, you receive the results in minutes, so right on the spot with the point-of-care test. The one that we do at the center is anonymous, so there's no ID required, status is not an issue, we will see anyone, we will not turn folks away for that reason. So we do offer this testing at the center, but we also, as I mentioned, we train of some peers as well, so that we can offer this testing in community as well. So oftentimes we'll be at things like Pride, Afro Fest. This Saturday and Sunday will be an Afro Care Fest in Scarborough at Thompson Memorial Park, and we'll be providing point-of-care testing as well as distributing the self-test kits there as well. So before I hand it over to Ori, I just want to know if anyone has any questions about the two projects and programs that I just discussed. Questions, comments? Okay, great. All right, so I'm going to hand it over to my colleague Marie. Oh, sorry, yes, go ahead.
So, point of care testing, do you provide the results there and then do you prepare the individual to provide them the results? Like, how is it like?
Yeah, so I can definitely give more, that's a really good question, and I can give more information about what that looks like. So with the pre and post test counseling, when we do the administer the test, depending on the person's results will depend on what their counseling session looks like. So if a person is negative after they receive the result, then we would provide them with tools and resources to keep them negative. So whether that be referrals for PrEP, other just talking about safer sex strategies, healthy communication and relationships, just whatever challenges that they may identify, we'll give them an opportunity to discuss that and give them some strategies on hand. Now, if someone were to test positive, then the process would be that we would request their consent to do a confirmatory blood draw, because similar to the HIV self-test kit, the point-of-care test kit is not a diagnostic test, it's a screening test. So in order to get the diagnostic results, our point-of-care testers are also trained phlebotomists. So we bring all of the materials that we blood draw on site. And this portion still remains anonymous. It's attached to a code. So we would provide the code to the person who tested. We would let them know that we're going to submit their, the blood draw in for confirmatory results, and we should have those results back in 1 to 2 weeks. We give them the code and we let them know to come back to the center at this time to collect those results. We also at that time, talk about things like disclosure, let them know and be aware of the laws and how they've changed and updated, who they actually need to disclose to and what that looks like. If they need further supports with disclosure, we were involved in a project that looked at creating a disclosure model. Because disclosure is not just, yes, there is a legal component to the disclosure, but it's also, as we all talked about here, right? What does disclosure look like when we may want to disclose to family members, to friends? What are some of the supports that folks may need in that process? We also will provide them with referrals to other organizations, as well as linking them with our organization. Irene is our case manager and supports the women living with HIV in our center, and we also have a health navigator, because another issue is system navigation. System navigation is really difficult, especially if you're a newcomer and you're not aware of some of the resources and things that are available to you. So our health navigator acts as that person to help guide the person through some of the processes and steps that they may need guidance with. So I hope that answered your question.
My question is in regards to the gender specificity of your programs. In terms of women's health, so what about men's health? And in terms of testing, going to care the POCs, are these programs accessible also to men?
Yeah, so great question. So there's actually a number of point-of-care testing sites located across Ontario. So usually if you go to Sexual Health Ontario, it will give you a list of all the different point-of-care testing sites. However, when we're out in the community, we don't turn anyone away. So regardless of your gender, your race, or anything like that, when we're doing community testing, we're going to provide those results to anybody who comes in for testing. So this is specific to us because we provide primary health care to these to our target population, because it has been shown that there is a disproportionate impact when it comes to women's access to certain services. So because of that, we prioritize those individuals, and we look at it from an intersectional place. So not just looking at it from their gender, but also looking at it from sexual orientation, immigration status, language, just a variety of different things. But we also partner with a lot of organizations like APA and Black Cat to provide that support for folks who may fall outside of our priority population. So really, it's a collaborative effort to ensure that all ACB community members are receiving the supports that they need. So I hope that answered your question.
Thank you. Actually, I had the same question that the current speaker was. I remember once, to me, it's a token of appreciation for what you presented, because I remember working in your team, because I used to have a question of what of men. But I remember I came to your projects and I bear witness when I was looking for. Thank you. Thank you.
Thank you so much. Thank you for supporting us.
I appreciate it.
So I will pass it over to Marie to continue on with the presentation.
Thank you, Natasha. And next slide. Okay, yeah, so as I introduced myself earlier, I'm the program lead for the Integrated Regional HIV Prevention Strategy for African, Caribbean, and Black folks in Canada. I just wanted to touch a little bit about the project and then dive a little bit deeper into the HIV self-testings, just to kind of walk you through the process of using the kits and So this project began in 2022, and it's a 5-year project going until 2027. And we have several organizations that are partnering with us on this project. We have APA, Black Hub, HIV Edmonton, Safe Link Alberta, ACO, and CAD, with Women's Health being sort of the center hub. So one of the major deliverables of this project is workshop delivery. So we focus on HIV prevention related workshops targeting either African, Caribbean, and Black community members or targeting service providers. And some of those topics include, history of Black people in Canada, the gender framing of HIV prevention, access to services, and more. And another thing is, through this project, we've also developed a World AIDS Day video that I believe everyone collaborated on, and it's since been posted on our on the Women's Health YouTube page. Next slide, please. And we also conduct, just another huge aspect, is conducting outreach, attending big events such as Pride and Afrofest, as well as smaller, community barbecue events, talking to community members about HIV prevention, distributing HIV self-test kits, providing point-of-care testing, which Natasha just talked about, as well as providing other safer sex technologies like condoms, dental dams, etc., which is basically what our table over there is here for. So this basically leads me into the HIV self-test kits. So at Women's Health, we began distributing kits, I believe, February 2023. And since then, we've been able to distribute over 6,000 HIV self-test kits, which is a huge accomplishment. And we were even acknowledged as one of the top distributors in Canada. We went to the CAR conference to speak on our accomplishments, where we shared the importance of our peers, our outreach peers with lived experience with varied networks, and it's with their help that we were able to achieve such a huge number and reach such a huge number of folks in Canada. Another great thing is we offer space at our center for folks to come, pick up the test kits. They can test themselves at our center. Some folks don't want to take the kids home and have the packaging in their house. So if you would like, you can get tested at our center. We'll provide a safe, private space for that, and you can even have one of us sit next to you and provide support while you do administer that test. Next slide. So these are some pictures from our outreach at Pride, Afrofest, and community barbecue event. Next slide. So these kits were approved in Canada in November of 2020, and they're phenomenal because they put the power in your hands. You're able to privately test in the comfort of your home or wherever you feel most comfortable. And these kits are also very discreet and conveniently packaged to allow for easy transportation. So I don't know if you can see it well, but that is what you would find inside each kit. You would find the lancet, the actual test device pouch, the membrane, a bandage, 3 bottles labeled 1, 2, and 3, and a package insert with the instructions. So next slide. And I'll just talk about some more information. So before using the kits, you want to make sure to follow these steps over here. So firstly, obviously reading the instructions very, very carefully before using. You don't want to miss, a simple step such as rubbing your finger until it's warm to allow for blood flow to improve, so you can get that perfect free-flowing drop of blood that's required for valid results. You don't want to use a kit that's past the expiration date, which is found on the outer packaging. Don't use the test kit in the device pouch has been damaged. Don't open the pouch until you're actually ready to use the kit. And finally, if you receive the kit in cold or very hot environments, make sure it reaches room temperature before you open it up and use it. So the next slide should show how to actually, so I'm just going to read over how to use it, and then I'm going to show a 1.5 minute video demonstrating how to use it. So basically, you use the lancet to prick your finger and form the blood drop. You allow the blood drop to fall into bottle 1, which has a red cap. You mix it by again a few times and pour the entire liquid into the test device. After those contents have been fully absorbed by the test, you mix and pour the contents of bottle 2, which has a blue cap. After bottle 2 contents are fully absorbed, you mix and pour the contents of bottle 3 that has a clear cap, and you can read the results almost immediately once the contents are absorbed into the device. So there is essentially no wait time. So I don't know if you can click the YouTube video so we can watch someone demonstrate. Once after testing. Oh yeah, there we go, there's a picture. And you want to make sure that there's that first dot, which is the control dot, otherwise it is invalid. So for support before, during, and after testing, you can either visit www.im.health, or the kits that we're distributing actually have a phone number attached to each kit, which when it's used, it leads you to a counselor who can also support you before, during, and after testing. We're there distributing kits. We encourage you to take more than one, whether it's for yourself, friends, family, or partner.
And like she just said, we have the testing kits. And if you need any, please speak from us. If you need us to support you test yourself, we are around and we have safe space for testing. Thank you.
We also have some other great organizations distributing kits here as well too. So give it up to APA, and as well as I believe CARE is also distributing kits. So so give it up to our other ESOs who are also distributing kits as well too.
Thank you so much. Can you please give them a loud applause? Thank you so much for all the presenters, the exhibitors, and our many speakers. Thank you so much. Can you please stand up for 1 second? Let's stretch, please. Please. Thank you so much, the exhibitors, the media team, the attendees. We appreciate your time. And for this moment, allow me invite my brother, Ronnie, for just a minute, because these people will need your services, trust me. Just for 1 second, can you come up and give us your contact and what you do, as my brother Mark getting ready? Yeah.
Good afternoon, team. Everyone, my name is Ronnie Bob. I'm a professional photographer. I do events, I do live streaming, I do video coverage on every occasion. Weddings, parties, boat cruises, any kind of function. We do photography, we do video, we do live streaming. Thank you so much. I'm a newcomer here in Canada. We need your support. Thank you. I have some business cards. My number is 437-557-2152. Again, 437-557-2152. Thank you so much.
My brother Mark. Okay, can I have Rishi, please? Come on see you on social media, they don't know who you are. Please come.
Thanks so much for this opportunity. Good afternoon, everyone. My name is Rick Henry. I'm the one behind Rick Henry Live, the YouTube channel. I'm a promoter, I'm a digital marketer, and also I'm an IT specialist. So in case you want to reach me out, my number is 647-768-2727. Thank you.
Mark, please, as he's coming, I want to recognize the presence of my brother, Mr. Tony. You're most welcome. We still have so many speakers, guys, get ready. After lunch, Mark, please.
Good afternoon, ladies and gentlemen, and everyone is okay. My name is Mark, and I hope you guys have been seeing pictures around with Swiss effect on them. I've done many proof events, but what I don't do what we actually do the same, but what I bring on the table is a 360 coverage. So I do pre, during, and post the event. So there's activities, promotion activities during the event. So I give instant reels, instant photography. Then post, we do post activities, shooting all that. So if you need me, I'll be standing in the corner, I'll give you a business card, and I work with a very big team, and I work with all these guys. Nice to meet you guys. I appreciate it.
Thank you so much. Stamp out. Guys, I said when I say stamp out, you read. Stamp out. Stamp out. Thank you. Can we have the media team here, guys, for just 1 second? Because this is something we want to have in our array. When we say stamp out, when everybody's standing out, and then they reply stigma, we want you to have that this mark. Thank you. As the media is getting ready, and Mr. Dennis Romala, please thank you so much. Mr. Dennis Semukwao, Foundation, thank you so much for the presentation, and everybody. Can we all guys come here and we'll record this video before we do the last session? Can we see the guys behind who are moving around? Let's stand up, all of us, and we say, please, 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 let's do this activity in the next few seconds.
So, don't fear, from this side, yeah.
Mrs. Doreen, please, could you join us? Okay, the media team, are we ready? Are we ready?
Just to make it interesting, we can have our speakers to come and sit here. Just the speakers.
Mr. Dennis, please have the seat. Mama, please move, please.
We can have our speakers.
You have a seat in front of the team.
I said this is the last one.
Mrs. Irene, Mr. Tony.
Let's get a clip.
Are you ready, guys?
Just organizing the picture.
Another hand clap.
Thank you so much. I want to recognize Women's College Hospital, Mrs. Esther Damalo. Could you please stand up and please go to us, please? She's just right here. Thank you so much for making me be present today. Thank you so much. And I just want to remind each and everybody who have certificates for you at the end of the conference. Please don't leave it behind. And I want to welcome each and everybody. It's your first time to attend this conference. years ago, breaking the silence has been happening. And I happen to share my testimony as I lost my dad at the age of 13 years old. And he passed away because of HIV/AIDS. My dad had 6 women. Wonderful. I love that. But Christians who believe having only one wife. And my mother was the official wife. I'm from a family of 24 children. 24 from 6 mothers. And I believe my dad could not go if we had a chance to attend such conferences by then. You know those days, back in the villages when someone gets sick, such services could not be available to them. And we had this saying of we have some Ugandans here. Kalokokale is something like that. Someone gets HIV/AIDS and you think someone is bewitching you. Right? He used to drink, take alcohol, sleeping around. And by the time we got to know that he was HIV positive, it was a little bit late. So we ended up losing our father. But one thing I remember, he passed away when he's shaking my hand. Just imagine 14 years old. I was living with my grandmother. He made sure that he invites me to come on his sick bed. By the way, I'm the last born among all his children. He shook my hand and he told me, Charles, HIV/AIDS is real and it kills. Be careful as you're growing up and try to watch out. I'm sure there's so many people that have passed away, that have lost their loved ones in almost the same way that when my dad passed away. I think it is a high time that we embrace the people who come out and declare to love them. And I'm here to encourage each and everybody here. Being positive is not the end of the world, because we've lost many people. And when it's not HIV/AIDS as the cause of their death, people die of malaria. If you look into the statistics, people die of accidents, typhoid, mention them, etc., etc. But if you are positive, don't get shy. Don't get shy of yourself. Don't feel you are alone. I've known people for the last 20 years who are on medication, and until today, they are still alive. They have made sure that their kids have gone to good schools. They have looked after them, cared and loved them. And I'm here to encourage you, my brothers and my sisters that are here this morning. It's not the end of the world, and we're here to support those who are still experiencing stigma. I want to encourage you that whenever you attend such a conference, please make sure that you have a pen and a notebook where you can take some notes, or in your phone. Sometimes we come here just because we don't have something to go home, some of us. But these are very important conferences because there is so much information to learn here that we can use in our daily life and for the future. We are not here to just pass time, take tea, have lunch, meet friends, and go home. Make sure you learn something today. make sure you go back home with something from this conference. Allow me to recognize the presence of Mrs. Winfrey, who will be replacing Mr. Dennis Sebugwabo in the next few minutes. And we still have a lot to take on, but as our theme today, as I requested, that we need to use these seats. Can we please do one more test? Can you use the front seat that is in front of you, please? Just one more seat. Please. As you use the chair that is in front of you, just one step. Please. You have all the time. I'm going to wait for you. We have 4 chairs here. Mama, can you please move a little bit forward, please? If you have any other question, please, I want you to shoot up your hand. We can get you a piece of paper, and if you're bold enough, you can step up here from our presentation for today, and I will welcome you. Would you please join me by clapping Mrs. Winfrey Leila, please? Thank you so much. Please clap for her. She's here. Keep clapping, please.
Good morning to you all. Good morning. Is it morning? Yes. By 2 minutes. Are we good? Yes, so you're most welcome again to the conference on breaking HIV stigma and related stigma, and I want to thank you all for organizing this session because it's really important and timely that we have a goal to work on, and the goal is to end AIDS by 2030. But that is not possible if we do not address stigma and discrimination. And I want us to have honest conversations this afternoon, because stigma starts with me and you, and also stigma starts from where you live, your community and family members, okay? So let's try to see how best we can tackle this issue that is convening us here. So once again, my name is Nicola Winfred, and I'm representing Mr. Dennis Sebugwabo, who is the founder of Yellow Foundation, which is You Only Live Once. And Yellow Foundation creates awareness around HIV and sexual and reproductive health, but also builds capacity of the African Black community, because we want to see thriving communities enjoying their human rights. So, I'm requesting for two volunteers from PTMO. Yes, because it's going to be fun, it's going to be interactive, but also educative in a way. So I have a few questions for us, and I would love to have 8 volunteers from the audience. Please feel free to raise your hand. 8 volunteers? Yes, thank you. Yes, thank you. Yes, so these questions are meant to address our myths and misconceptions. Sometimes you are stigmatizing someone or judging this person without knowing that you're actually doing it, or because you don't have the necessary information required to see how best you can support this person. So I'm requesting for another microphone, 2 microphones. Yes. I don't know if you can pass them around. Okay, so maybe I would invite, if you have a paper, could you please raise your hand? Yes, so I'll start with the beautiful lady. Could you come forward? Yes. So you're going to bring the question and just give your honest opinion about what you feel about the question, and I'll also invite other audiences to share their opinion. Thank you. I'm so sorry that we cannot unplug. Okay. Oh, okay. And Mr. Stelguba himself arrived. You're most welcome. On time? Yes. Yes, so could you please read your question and just give your honest opinion about it? Assume you are a parent living with HIV. Would you disclose to your children your status, and at what age? As a mother of 4 children, I would disclose when I realized that at least they are at least at 10 years if I am HIV positive. Because at that point I know they've studied about reproductive health, and I know they have a click about it. It will get the age of 10. Thank you so much. Any other audience with another opinion? Would you disclose to your child about your HIV positive status? Feel free. You have something to say? Yes, thank you.
Okay. To me, I think it's a yes. I could, depending on the current situation, depending on the age and the timing. So I think my answer could be a yes, because we all want to disclose if it's the right time to appreciate it.
Thank you so much. Any other volunteer with this piece of paper? Yes. I'm kindly requesting you. Sorry, the microphone, yes. The microphone can't reach directly to all the way down.
It's a simple question. Assuming you are a parent living with HIV, would you disclose to your children your status, and at what age? Yes, I would.
I will disclose to them because it's very important that they know what I'm going through, so that also they can be able to prevent, because I'm also to give the prevention messages to them at the earliest age they can be able to understand. I happened to be a health worker who was taking care of HIV patient clients in several places, and one mother who was my staff who was HIV positive asked me, at what time do I tell my children that my daughter I am HIV positive? Please tell her for me. I told her no. Tell her yourself. It will have no impact. When the girl finished Form 4, the mother told her, my daughter I am HIV positive. And in case I'm not living, you are auntie so and so, that is me, and will take care of you. That girl was the best in Form 4 by then. That was in back in my country. That girl wanted to be an engineer. Know what? She said, no, I'm not going to be an engineer. I'm going to be a doctor and research and see how we can help people with HIV. And today she's a doctor, and she's living it. She's taking care of HIV patients. So it's very important to share with the children when they can be able to understand. Thank you.
Thank you so much. I hope we are taking care of those important points. Any other person? Please, yes.
Right here. Assume you're a parent living with HIV. You can disclose to your children your status and at what age. Maybe to give a testimony. I also lost an uncle, I think in 2003. I was so young, in primary back then. But then I was so frightened about this disease because his status was really, the time he passed on, he was really someone you wouldn't want to look at. When they told me he had passed, I hid under my bed because I never wanted to go for burial, and indeed I didn't go. I would want to be honest with my answer. Being a believer, I want to read this from Proverbs 22:6. Train up a child in the way he should go, and when he grows up, will not depart from it. I indeed want to believe that a child, given the age when they don't understand, 3 years, 4 years, I think they should be trained about this disease so that when they grow up, they don't take it like badly. Thank you.
Good afternoon, everyone. My name is Helen, and the question is it true that a person living with HIV taking their medication daily and is suppressed and not transmitting the virus to their partner? My answer is, I think yes, because you need to be conscious with yourself and the other partner, so if you're free and you talk about it, you can still protect yourself by using condoms.
Thank you so much. Any other person? Yes, we're going to give them a listen and go to our right. Thank you. Thank you.
Hello everyone, good afternoon. My name is Meryl. The question is, you go for an HIV test with your sweetheart. You go for an HIV test with your sweetheart. And when the results return, he or she is positive and you are negative. Do you leave them or you continue the relationship with them? I'll answer on a personal basis. Depending on the level of the relationship. If I'm already married, and we're like, for example, I'm married, and we do routine tests with my husband. So if all the results have been coming up negative and this particular time is positive, it is easier said than done. But when you have the results in your hand, you're going to be very emotional and the first decision will be wanting to separate. But if you've educated yourself about the stigma on HIV/AIDS, you would seek a counselor and you find out are you going to use protection, or are you a discordant couple, or if you have children in the relationship, in the marriage, are you just going to separate because of the HIV? So you will find out ways of managing and staying together. But if you're a new couple, let's say you're in Canada, you just met a partner. I'm broadening this out because we're having children attending youth. If you have just met a partner, kindly go and have the HIV test done. Let it be mandatory. Do not be carried away by emotions. If the person is positive and you haven't invested so much time, money, and resources, you can still be friends. You don't have to engage and wait to become positive. That is if it's just a beginning relationship. But if the person is positive and you have a personal stand and values, you can talk about it on a mutual ground and everyone takes their path, but you can still keep the friendship. That's my take.
Thank you so much.
Any other question on my left? Or yes? And so yes, please. Thank you. Yes, Dennis. I'll be done with the gentleman and I'll come to you. Thank you.
Thank you. I just want to say something about the question we just answered. You know, some things are easier said than done. But we are at an HIV conference and we come here to learn, unlearn, and relearn. There are so many things that have been done in the arena of HIV. There's so much progress that has been made. There's so much scientific discoveries that have been made. And today we have something we call treatment as a means of prevention. Today we have things called PrEP. Today we have things called PEP. So the fact that one person is positive and the other person is negative does not mean the other person is going to become positive. If you're in a committed relationship, you can get onto PrEP perfectly. It's scientifically proven, it has been happening for years. So let's use such meetings to widen our horizons and to understand exactly what the HIV arena is looking like. Because there's a lot of progress out there and it's no longer a dead end. Thank you.
Thank you so much for that question, and Mr. Omala for representing that. So after this, after answering questions, I'm going to have a minute or two to talk about what we should do to address stigma through HIV prevention. Thank you so much.
Very touching. Tommy, he had met a girl and they had started dating, and he felt that they were taking it to another level. But he is HIV positive.
It's the same question. Assume you are a parent living with HIV. Would you disclose to your children your status? And at what age? Yes, I would. And I will disclose to them because it's very important that they know what I'm going through, so that also they can be able to prevent. Because I'm also to give them prevention messages to them at the earliest age they can be able to understand. I happen to be a health worker who was taking care of HIV clients in several places, and one mother who was my staff, who was HIV positive, asked me, at what time do I tell my children and my daughter I am HIV positive? Please tell her for me. I told her no, tell her yourself, it will have more impact. When the girl finished Form 4, the mother told her, my daughter, I am HIV positive. And in case I'm not living, your aunt is so and so, that is me, and will take care of you. That girl was the best in Form 4 by then. That was back in my country. That girl wanted to be an engineer. Know what? She said, no, I'm not going to be an engineer. I'm going to be a doctor and research and see how we can help people with HIV. And today she's a doctor and she is living it. She is taking care of HIV patients. So it's very important to share with the children when they can be able to understand. Thank you.
Thank you so much. I hope you are taking care of those important points. Any other questions?
assume you're a parent living with HIV, would you disclose to your children your status and at what age? Maybe to give a testimony, I also lost an uncle, I think in 2003. I was so young, in primary by then. But then I was so frightened about this disease because his status was really, the time he passed on, he was really someone you wouldn't want to look at. When they told me he had passed, I hid under my bed because I never wanted to go for burial, and indeed I didn't go. I would want to be honest with my answer. Being a believer, I want to read this from Proverbs 22:6. Train up a child in the way he should go, and when he grows up, will not depart from it. I indeed want to believe that a child, given the age when they start understanding, 3 years, 4 years, I think they should be trained about this disease so that when they grow up, they don't take it like badly. Thank you.
Good afternoon, everyone. My name is Helen, and the question is it true that a person living with HIV, taking their medication faithfully and is suppressed, cannot transmit the virus to their partner? My answer is, I think yes, because you need to be conscious with yourself and the other partner. So if you're free and you talk about it, you can still protect yourself by using condoms. That's my submission.
Thank you so much. Any other person? Yes, we're going to get that release that they go to our right. Thank you.
Hello everyone, good afternoon. My name is Aaron. The question is, you go for an HIV test with your sweetheart? Sorry? You go for an HIV test with your sweetheart. And when the results return, he or she is positive and you are negative, do you leave them or you continue the relationship with them? I'll answer on a personal basis, depending on the level of the relationship. If I'm already married, and we're, like for example, I'm married, and we do routine tests with my husband. So if all the results have been coming out negative and this particular time is positive, it is easier said than done. But when you have the results in your hand, you're going to be very emotional and the first decision will be wanting to separate. But if you've educated yourself about the stigma on HIV/AIDS, you would seek a counselor and you find out, are you going to use protection? Or are you a despondent couple? Or if you have children in the relationship, in the marriage, are you just going to separate because of the HIV? So you'll find out ways of managing and staying together. But if you're a new couple, let's say you're in Canada, you just met a partner. I'm broadening this out because you're having children attending you. If you have just met a partner, kindly go and have the HIV test done. Let it be mandatory. Do not be carried away by emotions. If the person is positive and you haven't invested so much time, money, and resources, you can still be friends. You don't have to engage and wait to become positive. That is if it's just a beginning relationship. But if the person is positive and you have a personal stand and values, you can talk about it on a neutral ground and everyone takes their part, but you can still keep the friendship. That's my thing.
Thank you so much. Any other question on my left? Or yes. And so yes, please. Thank you.
whispering, hey, can you imagine this? That man is HIV positive. What would be your immediate reaction? First of all, I'll feel shocked and hungry at the same time, because by the fact that I'm positive, I'm not embraced or loved by the people in the community, I'll feel so bad and naive. What we need to do in this situation is that people with HIV, we have to love them. We have to put them in a place where they have to feel like they are family or they are at home. We encourage them to take their medication and to do what's necessary not to spread the disease. Thank you.
Assume you are a parent living with HIV, would you disclose to your children your status? At what age? This is a very tricky question in so many ways. It starts with the parent herself. Is she accepting her HIV status, right? Is she getting support enough for her to be able to share this information to her children? Sharing this information to her children, it comes with an effect too. Are these children going to start telling to their friends that their mom is HIV? How am I going to start? I believe that the mom has to educate their children first, like, what is HIV? How does a person get affected? How does a person how can the parents prevent from not getting infected? So once the parent is able to accept their status, then she will have the courage to tell their children. The age depends on the child. Some child can be 15, but she's still not grown enough to be able to take this knowledge well. So it all depends on the child, but again, the child is a child. She's going to take this information in a wrong way, and she's going to be affected. So I don't know, like what age, to be honest, because every situation is different. And I come from Namibia, and I was working with HIV and AIDS people. Me working in the community, the people that I was working with, they couldn't even stand, they couldn't look at me because of the stigma, right? If they talk to me, then they assume that people, they say, oh, okay, that person is affected. So there's a lot of things that we need to learn and how we can support these people. So yeah, thank you.
Thank you so much for that wonderful comment. Please clap for her. Yes. So I think how many questions are left? Yes, so that's the last question, and then I'll come to wrap up because I have only 5 minutes left. Thank you.
Hi everyone, I'm Susan, and my question is, you have a child living with HIV and they ask to be taken to a boarding school. Would you disclose the HIV status to the head teacher? All I know, back home in Africa, stigma is so at a higher level. So even in the school, if the students know that maybe you or your parents is HIV positive, they already be pointing a finger at you. But yes, I will disclose to the teacher to help my kid. Maybe help them make sure they're taking their medication, and if there's anything they need. Yeah, but just make sure, I'll tell them to keep it private so that the kid, the stigma will not affect their education. Thank you.
Thank you very much. I know I came late, but thank you very much. I know I came late, but I'll take this opportunity to introduce myself. Ladies and gentlemen, myself called Dennis, aka Honorable Dennis. I am the Managing Director of the Yellow Foundation. The Yellow Foundation stands for You Only Live Once, and we believe in uplifting each other, mental health supports, immigration supports, HIV and AIDS programs for ACD individuals living within Canada and Toronto at large. It's always an honor to work with Pitmore. Last year we participated in Breaking the Silence. This year we thought we would do a different activity to engage with you participants in this conference. The major aim of you guys answering questions is to see, to gauge the knowledge gap that different individuals have about HIV and breaking the stigma around the same. We have a presentation. It's going to be presented by Ecline. Ecline is our programs manager. I think Mr. DJ, that is Women's Health and Women's Hands. We are the Yellow Foundation. Is everybody okay? Are we feeling higher? Are we breaking the stigma? Are we breaking barriers? I know Ms. Byler, you had a question about PrEP. It's going to be answered in the next segment coming up. We're just putting a few things together behind the stage. I don't want us to be bored. How are you, Ezekiel? Welcome to Breaking the Silence. Let's not be silent about the silence in the space. Okay? Can we have a music interlude instead? Thank you. This gentleman is from the Ministry of Health and he has something to say.
But it's about you being true to yourself. It's about being true to yourself because you don't want to make something as important as that. And then your partner finds out later. There will be some betrayal. But these are things that people we don't even know how much we just come and say we shall give you the support. But at that point, we have counseling services with that. So at Stigma, do you have counseling services for people who want to come out to their partner? Have you ever had counseling services like that? But HIV people fall in love. So what do they what's that partner is negative? You don't know what happens tomorrow. You don't know what your partner is doing at those conferences. Because you tested at the beginning of your relationship. But because you tested really hard. It doesn't mean that in the middle, things won't change. One time I was presenting in the Parliament of Uganda about the anti-homosexuality law. And I told this people, see, when you look at LGBT people, you look at them as them, those people. But you don't know who your wife is sleeping with. You don't know who your husband is sleeping with. And they're like, not mine. I'm like, yeah, everyone says not mine until it's yours. So right now we're...
Yes, so I'll start with the beautiful lady who come forward. Yes. So you want to read the question and just give your honest opinion about what you feel about that question, and I also invite other audiences to share their opinion. Thank you. I'm so sorry that you cannot unplug. Okay. Oh, okay. And Mr. Stigma himself arrived, you're most welcome. On time? Yes. Yes, so could you please read your question and just give your honest opinion about it? Assume you are a parent living with HIV, would you disclose to your children your status and at what age? As a mother of 4 children, I would disclose when I realized that at least they are at least at 10 years if I am HIV positive. Because at that point I know they've studied about reproductive health and I know they have a clinic about it. Yep, it will be at the age of 10. Thank you so much. Any other audience with another opinion? Would you disclose to your child about your HIV positive status? Feel free. You have something to say? Yes, thank you.
Okay. To me, I think it's a yes. I could, depending on the current studies, depending on the age and the timing. So I think my answer would be a yes. So we all want to be strong. It's the right time to appreciate it.
Thank you so much. Any other volunteer with this piece of paper? Yes. I'm kindly requesting you. Sorry, the microphone. Yes, the microphone can't reach directly for all the way.
So anything is still possible. Definitely to forgive yourself for anything that you may be holding guilt. Don't blame the other person. I know for me, I had to take the responsibility and then move forward and know that what's done is done, but I first found out that I was HIV positive in 2003. I was dating this guy. After we broke up, he called me on the phone and he told me that he was just tested positive. And it was so difficult to tell my son, oh my gosh. But he looked at me and he said, all I want to know is, are you okay? I'm doing everything that I wanted to do. I wanted to be married. I wanted to have a loving husband. I have a husband who has married me even with. So anything is still possible. Definitely to forgive yourself for anything that you may be holding guilt. Don't blame the other person. I know for me, I had to take the responsibility and then move forward and know that what's done is done, but it doesn't have to be the end. It's not the end. Talk about it. Don't make any rash decisions. Don't do anything out of emotion just because you're mad. Just stop. Think. Go to support groups. They really help.
When I first met her, I didn't know anything at all about HIV. I believed all of the lies and the stigma that went along with it and the misconceptions. I believe I had to go and educate myself, read, study, get the information so you know that it's not a death sentence, it's not the end of the world. One of the biggest things that I've learned is just tolerance. Once I met her, once I started participating in functions and being a support for her, I learned how to get along with everybody.
One of the things that's very difficult for me, I cannot really talk about HIV. Still, to this day, some of my family members don't even know it. I don't let it define me and who I am, but the message is important.
My wife has HIV, but that does not define who she is. Let's stop HIV together.
Get the facts, get tested, get involved.
Thank you, Levi. Thank you, ladies and gentlemen. It's really important to walk away with storage.
You have to talk to someone, you want to facilitate this, stand in their shoes, you know, to really, however, like they say, let's get facts, let's get the right information for us to be able to stamp out stigma. Yes, let's say, nowadays stamp out stigma, right? right? Say that after me. Stamp out stigma.
Stamp out stigma.
Yes, and we'll do that by participating in such meetings. It's not about, people who are in education. It's about you yourself. You being here, you're doing this for yourself. If you are living in your process, you are doing this for ourselves. But if you think you don't have HIV, you also do it for yourself.
Manager bulijjo ekitegeeza ebyakali byonna yabitutuusaako. Bulijjo neewuunya atusasula y'onoomukyala nga bakuyita mukyala
manager wa
Pitmo events. Ekyo kiwedde. So otuddeko ne number one promoter. Tawabulwa. Mwewale kujja ku mukolo.
Silence. This year we thought we would do a different activity to engage with you participants in this conference. The major aim of you guys answering questions is to gauge the knowledge gap that different individuals have about HIV and breaking the stigma around the same. We have a presentation. It's going to be presented by Eklai. Eklai is our programs manager. I think Mr. DJ, that is Women's Health in Women's Hands. We are the Yellow Foundation. Ms. Viola, you had a question about PrEP. It's going to be answered in the next segment coming up. We're just putting a few things together behind the stage. I don't want us to be bored. How are you, Ezekiel? Welcome to Breaking the Silence. Let's not be silent about the silence in the space. Okay? Can we have a music interlude instead? Thank you.
Pay and pray. I know by the time you go out from here, you'll be exhausted with all the information you need to know. I got a chance to visit the earlier concluded German conference on HIV. With all the progress and the additional effort which will put you down to curb HIV, I think by the end of this conference.
But nevertheless, thank you for being patient. And as I wrap up, again, I would love to remind ourselves that the issue of HIV/AIDS didn't just start today or yesterday. It has been going on for more than 40 years or so. And we are still working ways to see how best we can end HIV.
Thank you all. I'm Julius. My father is Arthur. As the DG is telling the presentation, I thought I could say as the theme, because I'm an international health worker, so like you say, you don't need to be silent. And like, as my mentor just said, dance for mother, we used to work together. So I thought I could add on a voice when one talked about suppression. This is a good thing, and it happens to be my mother. When you talk about suppression, when an individual listens and takes conscience about what we health workers tell you what to do, absolutely will get suppressed. Like a lady who had a question about pay and pray. I know by the time you go away from here, you'll be exhausted with all the information you need to know. I got a chance to visit the annual concluded German conference on HIV. With all the progress and the additional effort which you're putting down to curb HIV, I think by the end of this conference, all will be exhausted with the questions. Thank you.
Thank you very much. Ladies and gentlemen, I think ICLA is now ready to do the wrap-up of our activity today. Thank you.
Thank you so much. I apologize, and we apologize. Sometimes technology is so stubborn, but nevertheless, thank you for being patient. And as I wrap up, again, I would like to remind ourselves that the issue of HIV/AIDS didn't just start today or yesterday. It has been going on for more than 40 years or so, and we are still working ways to see how best we can end HIV. But we cannot do it without working with the communities. We cannot do it without supporting people living with HIV, access treatment, get retained onto care and treatment, and also support them to live well mentally and emotionally. So next slide. So as we talk about stigma, for those that have lived in Uganda, in the 80s, the face of AIDS was different. It was of a dying person, emaciated person. And when you look at the HIV virus, as you see it, the spikes, everything looks scary. So most times when someone tells you I'm living with HIV, that's what comes to your mind, you know? You look at a dying person, you look at how the virus looks like, and that's quite scary. And then now we have treatment. And with treatment, as you can see over there, HIV is just a virus that causes infection and damages a person's immunity. And AIDS is what happens when HIV progresses to its advanced stages. And when you're on treatment, like you've seen those, are they test tubes? Yes. The first one, we glue, those are our cells, but when HIV attacks the body, it attacks the human cells and takes over and multiplies. So if you're not on treatment, you're going to see the rates. The viral load is going to be high, meaning the virus is taking over. And that's not what we want to see. So how do we address the issues of high viral load? Next slide. So it's by one. You've been answering those questions I asked. If you were HIV positive and you go with your partner, and then he is negative, would you disclose to this person? Or if you're HIV negative and you go out to test with your partner and they are positive, would you stick by them? Okay? You've been answered these questions. You have been married for 10 years and then you discover that your partner is taking ARVs. Would you stick by your partner? Some would say yes, some would say no, and you don't blame the people that say no. Why? It's because they don't have the information, the right factual information. And as human beings, it's okay for us to react by being shocked, you know? It's normal for you to be shocked, you know, if you discover your partner is HIV positive because of the minds that you have regarding how AIDS was then, the virus, and how infectious you always thought about it. And if you have science. But the point is, how do we demystify the myths and misconceptions? Okay? And when Dennis this morning talked about what stigma discrimination is. Stigma, you're treating this person unfairly based on their HIV status or perceived status. And it's characterized by rejection, isolation, discrediting this person. Why? Because of what you think about when it comes to the virus HIV. Next slide. So how do we work as a community of black people, people of minority, to address stigma, because for so long we've been marking people living with HIV based on their status, making them feel inferior because of our beliefs and attitudes and the information that we have. Okay? Next slide. I'm so sorry I have to keep saying the next slide, but because of the kind of yes. So I want to talk about the 4 types of stigma that are happening in the community. And the most prevalent is the internalized stigma. You know, because when you test for HIV, the first thing you're going to ask yourself is, how did I get it? You know, where did I get it? Who gave it to me? And then there will be the anticipated stigma. Next slide. So this is what happens. I'm going to start assuming, you know, I'm walking and I know I'm positive. I'm going to start assuming, oh, I think this person might think I'm HIV positive. You start being conscious about your body, how you're looking, you know, because you are perceiving this person already knows your status. And this leads to the external stigma. You start being conscious, you start being isolated, and you fear to be judged because you think that this person already knows your status and they're not aware of your status. Okay? So the next slide, please. So I want to give you quick facts. Again, stigma is a very big thing, it's a structural thing, but me and you can be able to address it. And again, I want to tell you that someone will acquire HIV and they don't know that they have HIV. You know? Why? Because it was a marginal error. I met my sweetheart Dennis, and he told me he loved me so much, and we didn't bother to have an HIV test when we were getting intimate. And then Dennis unknowingly transmits the virus to me, and then we live happily together. And later on, I go for antenatal care when I'm pregnant, and I realize I'm HIV positive. I come back to Dennis and ask him, hey, let's go for testing. And Dennis also realizes he's HIV positive. I even went past to start blaming Dennis. You know, oh, you infected me. Not knowing probably Dennis had no idea that was positive. So I encourage all of us in here to know our HIV status. Know it together with your partner, okay? Because if you know HIV status, you can start treatment immediately. The health workers can counsel you and your partner and support you to enroll on medication, okay? And when you start your treatment, like I mentioned, and you're consistently taking your medication at the right time with the right instructions, your viral load is undetectable, like you're saying in those vials. Undetectable to the point that you don't transmit to your animal baby, to your partner, because science proves that. Okay. Next slide. But also, if you go for an HIV test and realize that your friend or your partner is HIV positive and you're negative, there's no need to run away, ladies and gentlemen. There is no need to run away. Because we have all the technology. We have PrEP. And I'm so happy that recently research was done. Instead of you taking your daily PrEP is pre-exposure prophylaxis, and it is taken by a person who is at risk of acquiring HIV. If you are in a discordant relationship, for instance, or I don't want to use a stigmatizing word, because criminalized in Canada. Like you have, it may not happen here, but in Uganda, people involved in sex work are high risk, for instance. We have people who have multiple partners, you know. So if you're that kind of person, you can use PrEP or a PrEP taken daily for 28 days. And also the good news is we have the long-acting injectable PrEP. By monthly injection to prevent, because some people are not comfortable taking the pill every day. And next slide. Yes, and also those who attended the HIV conference, we now have the vaginal ring. So this ring has PrEP, PrEP which is inserted into a woman's vagina. It releases this prevention prophylaxis every day, and you keep changing it every month. And the latest news is scientists discovered that a twice yearly injection can prevent HIV. This study was done in South Africa and Uganda to prevent HIV among young women. a shot twice a year to prevent HIV. So is that good news, ladies and gentlemen? I think we need to clap for ourselves. And let's stop at clapping. We need to advocate because in Africa we don't have these resources. We don't have them. We don't have the funding that Dennis was talking about. So how do we engage globally and locally to have these resources available? Okay? And then we also have other technologies other research pipeline. A pill is being developed to prevent both pregnancy and HIV. Contraception, 2-in-1. Why? Because again in Africa is where we have a high prevalence of teenage pregnancy. And I want to thank PITMO for addressing teenage pregnancy. How do we prevent our young girls from getting pregnant and HIV at the same time? So that pill is being studied. Okay? Next slide, please. Yes. Then PEP. And I'm going to emphasize on PEP. So many young girls coming into Canada who are newcomers are sexually exploited. Some of them are being raped and cannot come out to talk about it. Okay? And also they don't know where to go for help. So PEP should be taken within 72 hours of possible exposure. But how many girls come out to actually reach out to these organizations behind us? They don't know where to get information. So you and I have the chance to create awareness about it. If I've been exposed to HIV, I could be a health worker, a community member. Please get PEP because it will help you prevent HIV. The risk is reduced. Next slide. Yes, so as I conclude, I want us to be mindful of the stigmatizing language. Each time you say HIV infected sounds so crude. Each time you say AIDS people or AIDS patients, you actually make this person feel terrible about themselves because of that AIDS picture and dying imaginative person. But someone can tell you HIV positive today if you're taking your medication and your virus is smiling. Smiling means that I have been able to make it so dormant that cannot be activated to transmit to another person. Why should you call me an AIDS patient? I'm not at the end of the day dying, okay? So let's use words like people living with HIV or HIV transmission. Because when you say transmit, it's like I'm deliberately taking the virus to another person knowingly. And then, excuse me, yes, the next slide. So let's be mindful of language because it's our collective responsibility. And I'm going to play a second video. It's just seconds because it's important for us to know that the way you handle me will determine if I'm going to disclose to you or not. If I suspect that you're going to judge me and how I acquire the virus, I'm not be comfortable to disclose to you. Because I don't want to be rejected like Wamala said. I have a right to be in a relationship with the person living with HIV. It's not my fault that I got the virus. Probably I was born with the virus. So all I ask of you is to show me love, to encourage me to take my medication, so that I don't transmit to the next person that I meet. Excuse me, DJ. Sorry, MCs, I'm late when it comes to time because of the issues that I got. Would you play for me the second YouTube link? Yes. That one, yes. Yes, so as the MC supports us to play that video link, I want us to know that the lack of knowledge about HIV is a perceived facilitator of stigma. So with all the information I've given you, there is PrEP, there is PEP, we have the injection for ART. And we want you not to be comfortable enough to have a partner who is HIV positive because they won't transmit to you. Okay? So let's not judge people living with HIV, let's encourage them to take their medication because the ultimate goal is for us to end it by 2030. Sorry, I think the video is acting someone. Oh, it's coming. Okay, yes. So I don't know if you have any question as the video plays. Just one person. Are we okay? Can you say I'm stamping out stigma? I'm stamping out stigma. Are you? Okay, so if you have any question or any addition? Yes. Viola, do you have any question? Okay. Perfect. Any other question from the audience? Perfect. So the video is playing. Thank you so much.
And that he was married to me, even with. So anything is still possible. Definitely to forgive yourself for anything that you may be holding guilt. Don't blame the other person. I know for me, I had to take the responsibility and then move forward and know that what's done is done, but I first found out that I was HIV positive in 2003. I was dating this guy. After we broke up, he called me on the phone and he told me that he was just tested positive. And it was so difficult to tell my son, oh my gosh. But
you allow the blood drop to fall into bottle 1, which has a red cap. You mix it by burning it a few times, then pour the entire and you can read the results almost immediately once the contents are absorbed into the device. So there's essentially no wait time. So yeah, I don't.
Bottle 1. Remove the cap and place the bottle on a flat surface with care. Place the cap nearby to recap the bottle after you add the blood. Twist and pull the blue tip out of the lancet and place aside. Rub your finger until cool. Place the lancet on the side of fingertip. Press hard until you hear a click. Rub the finger to get a larger round drop of blood. Let one drop fall into bottle 1. Do not scrape your finger on the bottle. Twist on cap of bottle 1. Okay.
But before we go for lunch, let's stretch. Okay, what is what you do? Guys, I don't see people. Okay. Come so that we can have this. Thank you so much. Thank you so much, the visitors, the media team, the attendees. We appreciate your time. And for this moment, allow me invite you.
Sorry to interrupt. Just to make it interesting, I don't know if we can all come this side, and the photographers and videographers go the other side. And we make this a very meaningful moment. So we can use this moment to take the white pictures, and everyone, make sure you appear in this picture because it's a commitment, right? So can you all come this side? Just find yourself anywhere. Find yourself anywhere. These are our presenters for today. Don't fear them. Come closer to them.
say Stamp Out Stigma 2024, then we shall light out the candles. Mr. Nancy, I will please need you to take us to that. And then after that, we'll be going for lunch. Let's get ready. Thank you so much. We are standing this side facing the entrance. All the volunteers, please, everybody step up. Please, 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 let's do this activity in the next few seconds. Mrs. Doreen, please, could you join us?
From here, it will be our last one. Then others is fine.
Okay, the media team, are we ready? Mark, are we ready? Yeah, Mr. Dennis, could you please have a seat in front? Mama Pitimov, please.
We can have our
You have a seat in front of the team.
I said
Mrs. Irene, Mr. Tony.
Find yourself at the back. You can even stand at the top of the stage. Yeah.
Are you ready, guys?
Just organize it.
Right. Okay, can we light up the candles, guys, before we leave?
No.
Okay.
Can do it after that.
Mr. Dennis, take it.
So we should just actually go. Yeah.
All right, friends. Can we say 2020 or 2024? 2024, right? Okay. Stamp out. Only ladies, the mothers. Stamp out. The gents can do better than last time. Stamp out. Everybody, one more time. Stamp out. Can you wave to the online family, please, as we sing that? Stamp out. Thank you so much, Pitimo. Events. Thank you so much, the speakers, the organizers, the exhibitors, the social media, and all everybody that have made it so powerful for this event. Stamp out one more time.
Alright friends, could we make a circle? Instead of going back to our seats, let's just make a big circle around the seats. Whatever, ask to make a commitment. Because like I said in my presentation time and again, we come for meetings like this, and then we get our certificates and go home and forget everything. But I want us to create a commitment today. We want to commit that for us who are HIV negative, we shall keep negative. And for us who are HIV positive, we shall remain undetectable. I want us to make a commitment that we shall share knowledge, stand up against stigma, be empathetic, and share love. And after 40 years of getting HIV, I want us to make a change as a commitment that by 2030, HIV anymore. So as the ladies can just pass around the light to your neighbor as a signal easy. It's okay. Where's my superstar? Where's my superstar?
so that you complete the circle.
Anybody without a candle?
I'm just happy we have a team of very young people joining us in this fight. You can see Ezekiel came with his siblings, Elizabeth, Chris, and Javine. This all make a commitment that by 2030, HIV won't be an epidemic anymore. We only have 6 years, so make this commitment to 20 years ago. It's time for action right now. It's time to stamp out the stigma within ourselves and within the community.
We are stepping out Stigma.
You can take back our seats as you get ready for marriage. Just in a few minutes, we will give you the instructions on how we can do that. Someone networking as we get ready, as you await instructions on how to do your massage. Don't go yet, just a lunch break. Yes, everyone is just lunch break. We have so much in stock here to come. I don't want to serve you just that. And there's so much in stock for you. Just hold on, get back to your seats and make yourself comfortable. Yes,
Ladies and gentlemen, I think we are going to start with the speakers to go on the line to get food. But before that, we would love to have a volunteer to place our lunch. And then you do it. Thank you. Please, you're most welcome.
Our wonderful delegates, our guest speakers, our panelists and moderators, we are so delighted to have you for this HIV Express Silence. Give yourself a pat on the back and appreciate appreciate yourself for coming. A very big hand clap for all of you. Thank you. Let us now have, let's sing for our meals so that we can enjoy the meal after finding solutions to the HIV, AIDS, stigma, and discrimination. Heavenly Father, we give you glory. We thank you for the wisdom. We thank you for this wonderful gathering, and we appreciate you for giving us wisdom and knowledge to organize an event as good as this. We want to thank you for Solomon, Mama Pitmo, for thinking about ideas that are going to add value to the community. And now that we are going to share a meal, we pray that you bless it, bless the hands that are prepared, and give us energy to do all that we have to do for your glory. Christ, I pray. Amen. Let's give God a very big hand. Thank you so much.
Thank you, Ansu. Thank you so much. Yes, Mrs. Pitmo, please lead the speakers to the line, and then our partners will follow. The organization has made this place. You join, and then the rest. We shall follow those things. You have enough food. Don't think you're going to miss out. And there's so much after lunch. Music, our very own executive, speakers, and can I give us one? Come here, please. Enjoying our lunch. I want to take this opportunity to invite you tomorrow, same spot, same place, same venue. We have a show. Then we drink early, and we invite you officially. Entrance fee $50. Single. Same place. Let's come and have fun. Enjoy. It's going to be live music, live band music, and different performers. Please make it a point to attend. Just come and have the experience of red carpet and alone. Thank you so much. Tomorrow, 7 p.m. Then we'll enjoy that.
Hi, Ricky Henry Live. Ricky Henry Live. Woohoo! Shout out to Ricky Henry Live.